Hi everyone, this is PA in the AM coming to you with a disclaimer. I just want to let you know that this is for informational purposes only. This is not intended for medical advice. Enjoy the show. Good morning everyone, this is PA in the AM coming to you live from my bathroom. So the reason I wanted to speak to you today from my bathroom is because I have so many supplies in my bathroom that I'm talking about, and the second I gather everything up, I'm like, I might as well just do it in here. So what I'm going to talk to you today is about COVID-19 versus allergies. So my goal is to make sure you understand the biggest differences. And I actually made a Venn diagram showing the similarities and the differences between COVID-19 and allergies. So I've been a PA for the last 10 years and I work in ear, nose, and throat, head and neck surgery, pediatric otolaryngology. So I deal with allergies on a daily basis. So as far as the biggest difference between COVID-19 and allergies is if you have a symptom of fever. And so if you have a fever, that means that the body is trying to fight off a virus. That doesn't necessarily mean that you have COVID-19, but it could be one of the number one underlying issues. The other thing it could be with fever and viral infections could be the flu if you haven't been vaccinated, could be H1N1 or rhinovirus. There's so many different viruses out there. So that doesn't necessarily mean you have COVID-19. With the actual allergies, the main difference with allergies is that sometimes you can actually get a really severe anaphylactic reaction with allergies. Like say you have a peanut allergy or your child has a peanut allergy, and within minutes to hours they develop issues where difficulty breathing and swelling, sometimes an enlarged tongue. That is a medical emergency, and at this point usually it's with an EpiPen and that helps open up the airway, but you would call 911 and sometimes a patient would need to be intubated with a breathing tube to secure their airway. The main thing I wanted to discuss also is that pediatric patients, the ones that usually is when you find out you have the peanut allergy, it's very, very unlikely for children under the age of 18 to develop any sort of respiratory distress with COVID-19. At our hospital, we have, as of 2 days ago, we've had 0 patients that are on ventilators for COVID-19, and maybe 1 or 2 in the last 2 months that have been admitted to the hospital for observation. None of them have been in the ICU, which is reassuring for parents, I'm sure, and loved ones. But the ones that are becoming severely ill, like needing a ventilator, like say in New York, are ones that have comorbidities, like airway anomalies, or they have a decreased immune system, like if they're going through chemotherapy. So or cystic fibrosis. So some kids can get severe cases of COVID-19, but here in Southern California, we haven't seen really any at all. The symptoms that are similar between allergies and COVID-19 are runny nose, nasal congestion, itchy, watery eyes, sneezing, sore throat, cough, whether it's dry or productive, difficulty breathing, sometimes a headache. But these are similar in both allergies and COVID-19. So that's why it's hard to differentiate between the two. So the ultimate treatment for COVID-19 is symptomatic care. There's no proven treatment for COVID-19. And I'm sure some of you are like, well, what about chloroquinolone, which is an anti-malarial drug? There has not been an actual proof that this is 100% effective. So there's been a couple different case studies and things that have been done on chloroquinolone and azithromycin, which is an antibacterial drug for a pneumonia. This is a viral infection. There is no antiviral medication for COVID-19 that I know of yet, especially none that is FDA approved. So symptomatic care is the ultimate thing. And if you do have a really bad cough, what I would recommend is getting either Robitussin or the generic Tussin. And Tussin is a lot cheaper and it's over the counter and it's half the price. So I'll put a link below to Amazon so you can have some on hand if you need it. I always try to have 2 bottles at a time. This is for 12 and older, and it's a double the dose because it's generic, but I mean, it tastes actually really good. I think this one is raspberry, but you have to take 20 mLs. That's 4 tablespoons. It's kind of a lot. If you're under 12, there are some cough medicines that are approved, but just make sure you read the labels. The other thing I would recommend is to make sure you're staying really well hydrated. Another symptom of COVID-19 that is rare in allergies is diarrhea. And so if you're having diarrhea, make sure you get Gatorade, Pedialyte for the kids, and have at least 8 glasses of water per day. So if you are having diarrhea with allergies, that's usually more of a GI stomach upset symptoms, like if you're lactose intolerant, but you usually know that by now. So if you're having diarrhea and you had like a glass of milk or something before that, it's probably not COVID-19 if you're not having a fever. The thing I would wanted to discuss is whether or not to get antibody testing. And I could say from personal experience, last week, there was a testing facility that opened up in Cardiff, near about 10 minutes away from here. And I paid the $75 to get the antibody testing. 24 hours later, the testing facility was closed because there was no FDA approval for that testing site. So there are certain ones that are available in a hospital setting, but there's limited testing. So the other thing I wanted to mention is that in China, people are getting reinfected with coronavirus, meaning there are mutations of COVID-19. And so if you get an antibody test and you have the antibody saying that you were previously infected with COVID-19, it's not testing for every single strain yet. I mean, some of them we don't even know what they are yet. So even if you get it, it's not necessarily reassuring. It might just be a waste of your time and money and our resources. So the ultimate treatment for COVID-19 is going to be preventing it with a vaccine, which won't happen for 1 to 2 years. So make sure, you're doing social distancing, you're staying home and following the recommendations, because the best way to prevent it is to not touch your face and not go out without a mask, and make sure you're social distancing. So for allergies, the main way to control your environment is to first identify what it is you're allergic to. So there's a couple different ways you can get tested for allergies. The first quick and dirty way is to get a blood test, and the blood test tests for 13 of the most common environmental allergens: dust mites, grasses, ragweed, pollen, pet dander, and a few other things. So if any of those turn up positive, like for me, I'm allergic to dust mites. So the main thing with dust is that my symptoms with nasal congestion, runny nose, sneezing, that usually occurs at night and first thing in the morning. Because another great treatment for allergies is, of course, antihistamines. So antihistamines on the market are numerous, and studies have shown that Allegra and Zyrtec are 2 of the best allergy medications on the market. I hate to say it, but Claritin does not work for me, and I always buy generic because it's the same thing. And then the safest thing to do to help any nasal symptoms is a nasal saline rinse. And for me, I love using a Nedipot. So this is my little teapot. And my husband uses the NeilMed Sinus rinse. So I just wanted to demonstrate for you how to use it. So what you do is you use either distilled water. I always have one on hand in the bathroom, and we need to get a new one. It's almost empty. Or you can boil water and let it cool. You do not want to use any tap water. There was a case study done on a patient back east that used tap water, and there was a lot of bacteria in the tap water, and the patient had an infection that went from their sinuses to their brain and they died. So make sure, please use distilled water or pre-boiled water and let it cool. After you fill it up to the line, there is a special pre-mixed salt packet, and this has, how many in it? 250 salt packets in it. We've had this for like 3 years, and we still have a ton left. And me and my husband both have really significant allergies, and my husband has sinus disease. And so this is gonna last you a lifetime. So it's $10. You can get it at Costco. I'll put the link below. And it comes with all these little salt packets. Do not make your own salt packets. You'd be surprised what some of our patients do. But what you do is you just rip it open like this, and then you're gonna pour it into the distilled water, and then you cover it. There's an opening here, and then you shake it up really well. So you're gonna tilt your head down, and you're gonna tilt it off to the side with the neti pot. You're gonna put it in one nostril, and it's gonna come out the other side. Then you blow your nose really well, and then you repeat it on the other side. And you Lean forward, and you're not holding your breath the entire time while you're doing it. You're breathing, and you lean off to the side. For children under the age of 5, I usually recommend using the NeilMed Sinus Mist. And this sinus mist you just squirt it, and it makes a fine mist. So you just squirt in one spray in each nostril. They'll swallow it. You don't have to necessarily suction it out unless they're struggling to breathe. But the more you suction, the more congested they can become. So please limit your suctioning. This has high enough pressure that it'll wash everything down and they can swallow it. It's just like jumping in the ocean and swallowing a tiny bit of water, so it's completely safe to use. Again, I'll put the links below. You can find them at any pharmacy or grocery store. The other thing is the NeilMed Sinus Rinse. This one my husband loves to use. Like I said, you just fill it up to the line, do 1 salted packet, shake it up really well, and you're gonna lean over the sink straight up and down like this and just hold it upwards and squirt really gently up one nostril. Again, it'll come up and out the other side, and then again, blow your nose in between and repeat on the other side till it's empty. The links for everything are below. So your mattress and your pillowcase is encased with thousands of dust mites, and I know that sounds gross, but the best way to prevent all those dust mite particles from getting released into your nose, into the air when you hop into bed, is to get special allergy encasings, which zip close your mattress and your pillowcase. So every time you hop into bed, the dust isn't released into the air and you're not miserable all night long. And then washing your sheets with hot water at least once a week. That will help kill the dust mites. I know that's a lot of laundry. Get your kids to help, but just, designate one special day. Saturdays are our days that we wash our sheets and change our sheets. So we use hot water, and they're easy to put away before everybody goes to bed. The other way to treat dust mite allergy is to use one of my favorite nasal sprays called Flonase. Since it's Favorites Friday, I know I actually mentioned this before, but under my sleep video, but Flonase is my go-to medication for my entire family. We all have them labeled. This is my daughter Mia's. But if you have if you're running to the store to grab anything, I would recommend picking up Flonase, or I'll put the link below. Amazon, you can buy it. And for any nasal congestion, runny nose, sneezing, I'd recommend using Flonase. It's for adults 12 and older. It's 2 sprays per nostril, 1 time a day. And I do it at night before bed because I have dust mite allergy. But if you have more of like a pollen allergy, which we'll talk about, I would do it in the morning. And when you put it in your nose, you want to point it straight back this way. And you just do 1, 2, sniff it in. And then again, straight back this way, 1, 2, sniff it in. Dust mite allergy, I would also recommend considering a HEPA air filter. And that's if your dust mite counts are kind of through the roof based on what your allergy test results show. The HEPA air filter, the link is below, is something I would recommend in each person's bedroom that has a significant dust mite allergy. So if you have a mold allergy, and you would determine that after you have the testing done, for a mold allergy, a lot of times it's hiding inside of the bathroom. So if anyone in the family takes a bath or shower, just make sure they have the window open or there's a fan running to help prevent mold from developing. The other thing is to get rid of any dense vegetation in the house, because that could carry mold. And then if you have a dilute bleach solution, I would recommend cleaning around the windows and in the ceiling, because that's where mold likes to hide. If you get a lot of nasal dryness and or nosebleeds, it's important after you use the Flonase or your oral antihistamine to use a nasal saline gel. And I would recommend, one of the brands is called Ayer, AYR, look below. And you put a little bit of the gel onto a Q-tip or your pinky finger, and you just want to paint the front side and part of the nose on both sides. And you want to be a little bit generous with it. And then you do it in the morning, right after you put the Flonase in, and or at night right after you put the Flonase in, but you want to do it twice a day if you are having any nasal dryness. If you don't have nasal dryness or nosebleeds, you don't need to use the nasal saline gel. Okay, so the other thing is, if there is a pollen allergy, the best thing is to keep your windows closed at night, and during the day, if you know you're going to be outside, try to take Allegra or a non-sedative antihistamine in order to prevent you from getting all those nasal symptoms or itchy, watery eyes. And if you have an allergy to grass, again, you would get the allergy test results and it came back positive for grass. Like say your kids play soccer, I would recommend using an oral antihistamine 30 minutes before you go outside, in addition to using Flonase 1 to 2 sprays per nostril a day. The last thing I wanted to mention is one of my favorite products for those allergic shiners or the dark circles underneath the eyes. So there's a product from Rodan and Fields called Active Hydration Bright Eye Complex. And what you do is you place a thin layer underneath the eyes every morning, and it helps deliver moisture, awakens and refreshes tired eyes, and 93% of users reported brighter eyes. Now until April 30th, so only a few days away, we're offering free PC perks, meaning you'll receive 10% off of every order for your lifetime and free shipping for orders over $80. Please click the link below or check it out at PAintheAM at rodanandfields.com. So yesterday was my daughter's 7th birthday, and her first grade teacher emailed me the day before and said she wanted to do a surprise visit around 1:30 to surprise Mia. And a couple hours before she came, I thought, well, maybe I can call some family and friends and they can come surprise her too, like a parade of cars. So I texted a few people, and within 2 hours, there was well over 20 cars that came through our neighborhood, and people had signs and they were ringing bells and they brought presents. And I'm just still blown away by the generosity and how the community came together. And it was truly such a blessing. I just can't believe it. And my daughter Mia, it's the 3rd birthday we've celebrated from all 3 of my kids in the last 30 days. And I have to say it was one of the best birthdays that we've ever had. And so just make sure that you're reaching out to others in your classrooms, your coworkers. And if anybody is having a difficult time, just, leave them a special note or a gift, or ask if they need help with special groceries, and do what you can. Hopefully this pandemic will be over soon, and I hope everybody stays safe. If you have any questions, please drop them below, and please be sure to subscribe. This is PA in the AM signing off. Please tune in next Friday. Have a great weekend. Take care.